Dr. John Simmons, thank you very, very much indeed for agreeing to be a part of the Breaking Through the Void Summit. I am delighted indeed to have you here today and to talk to you about healthcare and indeed integrative model of healthcare and how that works with the current National Health Service and the current mainstream healthcare, really, I guess, globally. So we're going to be talking about, just as I said, about whether integrative medicine can save the NHS being the National Health Service here in the UK. But actually, whilst our conversation will focus on that, because of course you are a doctor in the UK, really I think what we talk about is applicable for mainstream healthcare globally. I hope you agree. Oh, yeah, yes. Good. So just to let people know who you are, I'd like to just read your bio, just to position you, and then we'll get started. So Dr. John Simmons, you work part-time as an NHS GP, so general practitioner or medical doctor at the Simmons Integrative Health Centre in East Sussex in the UK. And you are pioneering an integrative model of healthcare, combining the best evidence-based complementary and alternative medicine with conventional orthodox practice. You work in an award-winning sustainable building that you created in order to address some of the negative health impacts that buildings have on both the patients who visit and those working within. And the Care Quality Commission recently awarded the healthcare an outstanding rating for the patient care that is delivered and the collaborative community-focused healthcare model. When you're not working for the NHS, you run vitalityworks.co.uk and you work collaboratively with other practitioners to deliver workshops and seminars to enhance vitality, well-being and resilience, and enable participants to live a more connected, conscious and healthier life. You recently appeared on ITV's Tonight Show, highlighting your model of healthcare to enhance healthy ageing. And your vision is to create a sustainable health service that empowers people to enhance their vitality, take control of their health, and to achieve the outcomes that they desire.
Wow, thank you very much. Lovely introduction. I didn't realise I was achieving quite so much.
Well,
thank you, Julia. It's a real pleasure to be here.
Great, thank you, John. And I think you're being very kind on yourself. But actually, what you're doing, to me, from what I'm hearing there, sounds extremely pioneering and is long, long overdue. And I'm so delighted that you're here today because, the premise of the summit is about breaking through the void, breaking out of that place where we may find ourselves stuck, or when we're facing the seeming chaos of the world and just not knowing which way to turn. And from what I see with my own clients is that often people can be in that place because of health issues, because when you're not feeling well and when you've got disease or something like that you're dealing with in whatever form that comes, that can have a real impact on how you see the world and how you approach everything. So I love what you do in terms of, integrating with conventional healthcare the more alternative practices as well, because I completely believe there is a place for all of them. So I'm really excited to be talking to you. So anyway, enough of my waffling. Let me get started with some questions. So I just touched upon the summit there and how it is about discussing the feeling of kind of chaos, that appears to be evolving in the world. And I'm curious about whether you agree with that, whether you see that sort of chaos in the world and whether your patients do, and actually how that manifests in your patients.
Right. Well, thank you. Yes. I mean, who couldn't really be aware of chaos currently in the world? Not just in healthcare, but I mean, environmentally, politically. I think it's a really, really strange time, and you'd have to be pretty switched off not to be picking up on that. Yeah. Purely from the healthcare perspective, though, yes, you're right. I'm an active family physician, GP, as we call them here in England, and I will see up to 50 patients a day, so maybe 200 to 300 patients a week, and I'm seeing a lot of people presenting with a variety of symptoms, and there's no doubt that a lot of their presentations are in some way reliant, well, not reliant, but are dependent upon a feeling of chaos. It definitely underlies a tremendous amount of presentations that we see. I'm seeing so much depression and anxiety, and that's definitely escalated over the last last 2 to 3 years, in line, one would have to say, with changes globally, what we're seeing out there in the world. In fact, I did have a patient in not that long ago who came in with headache, actually headache and neck pain. And in fact, when I sort of broke it down with her and said, I think you're worried. I think you're really anxious about something. What is it? And she actually went on to talk about Donald Trump and how he was really unsettling her. And I remember thinking, my God, I think I could really label her if I wanted to as having a condition that, you could almost call it Trumpitis. It really is, a reaction to circumstance, and it's causing tremendous anxiety in people. And this anxiety is definitely based in chaos. This is what I'm seeing. From all sorts of symptoms, not just depression, not just anxiety, but irritable bowel, irritable bladder, neck pain, headaches. All of these symptoms are based in tremendous amounts of fear and worry. So for me, chaos is manifesting in pretty much all of my patients in some form or another.
So when patients come to you presenting with these symptoms, how do you get them to understand the disconnections that underlie those symptoms?
Yeah, so of course, when a patient presents to me, I am first and foremost an Orthodox doctor. Where I work, that's who they're meeting. I don't work in a purely complementary alternative field. I work in a conventional Orthodox environment, because that is really all we have set up within the healthcare system over here in England. Yeah. So when they come to see me, I have to treat them with an Orthodox framework, if you like, and get them, and ascertain their symptom picture, rule out things that matter, serious or sinister pathologies that could underlie how they're presenting. But once you have broken it down, and once you have got to that point where you realise that actually, there isn't anything really sinister that underlies how they're feeling, that actually it is made up of their perceptions of themselves, their life, where they are, the world globally, you can begin to start to plug that back. And how I do that is actually to kind of get them to see that their level of heightened anxiety can cause tension in their muscles, in their neck, in their shoulders. That can give them the symptoms that they're experiencing. And then what I try and do is break that down further and show them really how that chaos is fundamentally a disconnection from themselves, from them not wishing to really experience what they're experiencing on an emotional level, on a felt level. Once you begin to touch that subject, you can start to develop a little bit of curiosity. And for me, curiosity is definitely the way to reconnect. Once you begin to reconnect, you can re-establish a sense of sort of conscious awareness of what might be happening for that individual. So you have to break it down quite systematically. I talk a lot about vitality with my patients. So I try and explain to them that whilst they're experiencing real physical symptoms, we just need to move a little bit away from this sort of biomedical model that we've all trained on as doctors, that is used as our orthodox framework for explaining symptoms and how things have come into being, and just get them to think a little bit outside of that, in an energetic way, to think of, feeling tired all the time, or having no energy, having irritable bowel, having muscle aches, can very much be due to a loss of vitality, with vitality essentially just being, your vital force, your life force, your get up and go, your chi, your Jedi warrior spirit, whatever it is for you. It doesn't really matter what we call it, it's how you can identify with it.
Yeah.
And once you begin to see that actually maybe a change in my vitality is underlying how I'm feeling, you can begin to get people to identify with that and identify with that concept, and then potentially look at the causative triggers that may have led to them presenting, with symptoms of illness and sort of dysfunction.
So when So what I'm kind of hearing here is, you know, when people talk about healthcare and they talk about the more complementary healthcare, they talk about holistic healthcare, you know, looking at the whole. Is that sort of your starting place when it comes to vitality and you work with patients? Do you get them to start looking at the bigger picture and, you know, what's going on for them and how, you know, perhaps what's presenting is just one part, and sort of look at all the different areas of life at where the drains are and the positives? How does that kind of, how do you do that work?
Yeah, so holistic is a very good word. So what I will always do with patients, so, you know, patients never present with one symptom. Okay, they've always got a collection of symptoms, and they very often seem or appear to be on the face of it very separate. But invariably, depending which framework you use to assimilate the information you're being given and how you view the formation of disease and symptom pictures, you can get people to understand how they're all related. If someone is presenting, you know, someone will often present with a pain in the neck plus, you know, some loose bowels or some irritation in their bowel, or, you know, or low energy, no stamina. Now, of course, all of those symptoms have to be connected, because it is, in a sense, that individual's vitality and distortion in their vitality that is causing their symptoms. And it's really good to be able to connect them for people and then reflect them back to them and explain to them, if you look at it purely from an energetic perspective, if your vitality is low, your resilience will be low, and you are more likely to be susceptible to whatever it is that's in a sense going on in your environment that could be influencing you, potentially in a negative way and causing illness. Yeah. If someone is particularly stressed, their immune system is diminished and depleted, and they are undeniably more susceptible to just, you know, common pathogens that are circulating in their environment. This is why someone catches a cold when their neighbour in the office doesn't get it, for example. Yeah. So linking up these symptoms is really useful for patients, and it very brings them on board, and it makes them more receptive to the concept of an energetic framework, i.e. their vitality, as being the element that they need to focus on, rather than focusing on the pain in my leg and the tinnitus in my ear. It's about saying, look, this is a distortion in your life force, and if we correct the distortion, both of those symptoms are highly likely to correct. You don't need to treat the tinnitus separately to the leg. You know, for some people that is a little step too far, and you have to bring in medicine. We have to use antidepressants, for example, for some people with low mood and anxiety, because they're simply not in a place to grasp that connection or that concept and work with it. So, you know, you need to potentially distill their level of anxiety to get them to the point where they can just stop and rest enough to be able to embrace that. But once you've done that, I find over and over again how many people, you know, when you're talking to them about vitality, which is a concept maybe they've never come across, and you reflect back how, you know, maybe your depression is related to, you know, unresolved grief, you'll just see them nodding in the chair. You know, whilst it's something that they may not be expecting to have reflected back to them when they present it, they are invariably receptive to it on a much deeper intuitive level that you're endeavouring to reconnect them to, of course. Yeah. Because for me, distortions in vitality are essentially based in chaos. You know, if you measure, we can measure this. We can use, you know, bioresonance and biofeedback tools looking at heart rate variability. And when you look at the patterns of heart rate variability for someone in a state of anxiety or fear or regret or resentment, you just see a completely chaotic pattern. Yeah. As opposed to someone who is in experience gratitude, love, appreciation, joy. Their pattern, their rhythm is much more regular and rhythmic. Yeah. And, you know, this is another really lovely tool actually for some people who do need that kind of biomedical connection. They want to see something really tangible with lights and noises to get them to understand that actually, you know what, if you just slow your breathing down, you could change your vitality. And changing your vitality will ultimately change your physiology. Change your physiology, you're going to change the way you feel in any given moment. So that is really powerful. That's a lovely tool to bring in when people are struggling.
powerful and empowering, I would imagine, you know. And I know what you're talking about, because I'm a heart math coach, and in the summit we've been lucky enough to speak to Rolly McCratey from Heart Math as well, and he's talked taken that to another level, talking about the energetic rhythms of people, and showing how they get in sync with the energetic rhythms of the earth, you know, which is just, I love it. I could talk about that forever. But you know, it's really refreshing to hear about your approach in terms of what you were saying about people maybe presenting with a symptom. I think you said tinnitus and a sore leg or something like that, you know, but actually by looking at their vitality and approaching it from a completely different, more holistic angle again, that naturally goes away. And you know, it sounds so right to me. It sounds like such a good approach that, you know, symptoms are never isolated on their own, are they? They're you know, you are a whole person, and you come as a whole package of different things and different emotions and events that's happened. And you know, I just love what you're saying. But I'm kind of curious then, you know, what you're doing, has that been difficult to achieve in the NHS, in kind of mainstream healthcare? Are people starting to be more receptive to it, or is there a lot of resistance?
I would say people are definitely becoming more receptive to it, and there's a real swing away from conventional medicine, on the basis that it has always, and this has been one of my issues that I've always had with my conventional training, is that it very rarely addresses the causation of illness. That can't be said for every illness, of course, but using purely a biomedical model and just dealing with patient symptoms and listing their symptoms is never adequate as a way to treat someone at the deeper level that achieves, almost a cure or a healing. What I found going through medical school was that we never ever seemed to get to the root cause of why someone had fallen ill. We listed symptoms, we then gave them an anti-symptom pill, and we have to admire the pharmaceutical industry for achieving that. They've done a brilliant job at giving us antihistamines and antibiotics and antidepressants and antidyspeptic pills, which we've asked them to do, and they've done it superbly. But of course, why has that patient fallen ill in the first place with their depression, with their anxiety, with their indigestion? And so for me, I've always had that little nagging doubt in my mind that we weren't ever getting to that root cause of illness. And I do believe, certainly with the patients I'm working with now, that they also ask those same questions. But why, doctor? Why have I got indigestion? The easy thing to do in a 10-minute consultation would be to just give them an antidyspeptic pill to treat their indigestion. But it's so unsatisfying for both me as a physician and for them as a patient. And they are asking more questions and delving more and challenging their physician and asking them to explain why it's coming into being. So from that perspective, I'd say there definitely is there's a more receptive environment to approaching things in a more holistic way. And certainly here in the UK, there's a really big swing towards more preventative and proactive care planning and care management, which is great because, of course, if you want to try and get to the root cause of an illness, that's great, and you want to seek that, and you want to understand it and work with it and ultimately help that patient to remove it or soften it or dissolve it. But going forward, you want them to stay well. Now, for them to stay well, they have to then put in place the tools and the strategies that will keep them well. And again, I would refer back to vitality, keeping their vitality in the best possible shape that they can do this. So in my environment, I'm certainly struggling to get the concept of vitality across, but I'm not struggling as much as I did maybe 10 years ago at getting a more receptive audience to treating patients more holistically and proactively.
That's great. That's really good to hear. And kind of talking about that. So I remember when I saw you on the ITV program, and you were saying, and forgive me if I get this wrong, you were saying about how sort of in older patients, how, for a lot of them, they can feel very lonely, and, things like that will lead to a lot of their symptoms and I guess vitality again. And you've put in place some quite interesting solutions for that. So I think they can do like yoga or Tai Chi, or you take them hiking. And can you just talk about that? Because I loved that.
Well, thank you very much. Yes, the health centre we set up here was created about 3 years ago, and the vision behind it was definitely to create a much more collaborative environment. Mm-hmm. So there is an amazing array of incredible therapists out there who've trained in complementary alternative medicine, who can really support and work alongside conventional Orthodox trained doctors as well. So the health centre we established had that in mind at its core, if you like. And right from the outset, we wanted to engage with the community, understand their health needs, and look at some of those vulnerable groups. So as you quite rightly point out, an elderly patient who comes to see me with a variety of symptoms, you can almost always pull that back to them being lonely and isolated. And actually, that is fundamentally their issue. In that loneliness and that isolation, all they have time and space to do is think about that pain in their knee or that pain in their leg. Whereas, if they were distracted and doing other activities, it just isn't so prominent. Now, nothing has fundamentally changed with that patient's leg, but they are experiencing a completely different set of symptoms. So we set about looking at what evidence was out there as well, in terms of what activities would reap the best rewards, I suppose, for us. So, there was an excellent paper that came out a couple of years ago about exercise, the miracle cure, and how exercise is more powerful at treating diabetes and dementia. In fact, it's probably the only single treatment for dementia that's been shown to be of any value, way above any pharmaceutical intervention. So one of the things we set up was a walking group. We looked at the walks that were local, the routes that we could go on. It was sold as a walk with a doctor. It was another opportunity for patients to consult with their doctor in a less formal, maybe slightly challenging environment. And we would go off and have a lovely walk in nature. Yeah. Now that has the benefit of connecting people with nature again, which is really important for their sense of well-being. And also, it was a wonderful opportunity for me to get out of the office as well and away from my desk that I sit in front of for 12 unhealthy hours every day. So I had a dual benefit. So that was set up and has been taken to another level by a group of local walkers who have embraced it, and they now take more and more patients on these walks, and the groups that are developing and the connections that these individuals are having with each other is so amazing. It is quite humbling, actually, that we're achieving such incredible interventions and such amazing outcomes on these patients. We have actually studied a lot of them as well and looked at their rates of attendance at the doctor's surgery before they joined the walking groups and before they joined the choir, which we've set up, or the Tai Chi classes, or the meditation groups, and looking at their attendance rates at the doctor's surgery afterwards. And it's dramatic how much that has changed and how much that has diminished, because they are beginning to take control of themselves, their lives. They're beginning to own themselves. They're beginning to understand that actually they have a part to play in their health and their outcome and their prognosis. And by taking control and being empowered, they're running with it, literally running with it. Yeah. And some of the data we're getting is such a positive endorsement of what we're doing. I'm just trying to think of the other. We have, for example, we don't have any posters up in our waiting room that show people having heart attacks or strokes, or you must get your child vaccinated, because whilst that all goes on and happens, and we will respond to it appropriately, there's no point in actually just heightening anyone's anxiety whilst they're sitting waiting for a doctor.
Yeah.
So you've got to create the right environment. Has to be there from start to finish. It's a much more welcoming environment. It's lit completely differently. It's soft and welcoming. A lot of people actually, in fact, walk in and wonder whether they've even arrived at the doctor's surgery. They sort of have to look back out the window or the door and have I gone into the right place? So that always makes me smile.
Wow. God, that's so amazing. And I know you said something then that's absolutely come up through this summit over and over and over and over about how we are disconnected, and we're disconnected with each other, with our communities, with nature, and that reconnection really works. But what I love about what you said there, well, I'll come on to a couple of things. One, I love that your local walking group has run with that. So in fact, your sense of community and connection with all of those locally, has absolutely grown. You didn't need to do, you just needed to start the ball rolling, and then that's run, because naturally it's what people want to do. Which, brilliant. But I also love what you said about how the data has shown that you've measured that, and to say, right, before people started doing their hiking or singing or whatever you did, how many times did they come to the doctor, and has that dropped off afterwards? That's really compelling evidence. And so I guess we started off talking about the NHS. Is this an integrative approach? Is that my understanding? Is about looking at all the different sort of things that can be done, like this, different approaches to I guess, bring together different practices for the whole, for the people. So sorry, I didn't ask that properly. What I'd like to understand is an integrative approach, and then what I'd like to lead on to is coming back to the NHS. Do you think that's what the NHS or mainstream healthcare needs? Because it sounds like it does to me.
We absolutely, I mean, I couldn't agree more with that. You're right about an integrative approach. So that is definitely a collaborative working model. Yeah. So that is, for me, the collaboration of therapists from all different specialities, from all different arenas. And collaboration also means collaboration with your local community. We are a rural practice, so we probably have more of a community spirit than you might find in towns and cities. So we haven't struggled to get engagement with our community as you might expect in other areas. Yeah. But definitely, for me, integrative is tapping into all of these incredible resources that are out there. There are so many charitable organisations and community projects that are existing alongside us, but we're unaware of it within mainstream medicine. And we are tapping into this. And what's happening is that the sort of pioneering spirit that we have here, and the innovation that we have in wishing and wanting to create new things in an integrative way, is definitely bringing in people who are so willing and so ready and so able to take part in that process. The partnerships we've set up with our local council, with our county council, with our local leisure health centre, leisure centre, it's just been amazing. And they also get something out of it, because we're all benefiting. What we're doing here is we're changing people on an individual basis to start with, but as they change, it has an impact on their family. When an individual's depression lifts, the whole family benefits. And if you start to expand that, if you can change, the mood of your community, then that whole community begins to change and interact on a different level as well. And it's not difficult to see how that is contagious. That's something that would spread and will infiltrate further and further afield. And who knows, potentially that could work on a global basis if we all work in that lovely collaborative and cohesive way. One thing I will tell you, talking about the walkers earlier, I remember the walker saying to me, the woman who leads it now. So she's a local lady who just knows just about everything about plants that you could possibly know. And she actually came up to me once after a walk, and she said, I can't thank you enough for setting up these walks. And I said, I must thank you, because you're so amazing. You have all this time to take these walks every week. I said, I admire you. She said, she said, you don't need to admire me. For me, it's such a wonderful experience. I get so much out of taking people on these walks and seeing their faces and seeing them smile. Seeing the man who comes along with a wife who has dementia and he never gets out, and just seeing the lightness in his step, the way he smiles, as he's embracing nature, as he's getting out and having that little break that he needs just to reboost his own vitality, so he can continue to do the amazing caring role that he has, for example. So once I think you've set up these connections, they just perpetuate. It just happens. More and more people start to inquire, more and people start to ask. I think because they're also seeing the changes in their family members and in their relatives. They're witnessing the choir now singing and doing public performances. And they're thinking, hey, they all look really happy. I want a bit of that. I'd like to taste that. What do I do here? And then, people are willing to sign up. So it's having a wonderful influence locally.
Yeah.
And for me, definitely, this is the future. This is the only way we can ever create a sustainable healthcare system is by moving away from the disempowered model of, the patient coming in, handing it over, doctor fix me, give me a pill, take these symptoms away, and moving towards one of empowerment and just reflecting it back and saying, hey, you know what? This isn't as scary as you think. We can work with you on this. I can help you to take back control of this. You need to be part of that process. But, once you do it, it's the most incredible and liberating thing you can do. And it's ultimately on such a deep level that they really do cure, they really do heal. Their symptoms go away forever. Not just away for the moment whilst they've been suppressed, but away on a more permanent basis. And they never look back. Once you have experienced that great sense of health, vitality and well-being, you can't see things in the same way again.
Yeah. So we're nearly drawn to a close. One thing I would just like to ask then, I think the work you're doing is incredible, and I'm so glad you've talked about it today, because it I think we all need to start thinking in this way when it comes to healthcare. And just hearing about your sort of collaborative approach and the effect it's having is brilliant. But I guess for people who may be watching this that are facing some sort of disease or crisis or illness, that may not have that network of support in healthcare around them, what sort of could they do to empower themselves to take control of their health in their situation? What would you recommend to them?
Right, that's a tricky question. And one thing I would say for people who I guess aren't lucky enough to have the facility that we offer in our community is that we are beginning to spread the word and we are beginning to roll this out. So things are going to change. So that's on an upbeat note, things are going to change. To answer the individual specifically, I would say it's three words that I use on a lot of my training seminars, and they are curiosity, connection, and consciousness. And what I would ask people to do is to begin to get curious about how they're feeling. Just begin to think about your symptoms in a slightly different way. And rather than instantly getting to that point of fear, because it's just been ingrained in us that every lump has to be cancerous and every abdominal pain has to be a tumor, but actually begin to think about, okay, I've got a pain and I'm feeling a pain. Let me think about this from the framework of vitality and energy flow. So if I just start to delve into it a little bit deeper, they will definitely make a different connection with that pain that isn't instantly one of fear and worry and anxiety, but moves towards a little bit more of a connection to themselves as a person, and maybe begin to understand potentially some of the lifestyle traits that they may possess that could be contributing. And your body is very willing to give you some feedback if you're prepared just to still yourself for long enough to hear it and to feel it. So get curious, connect with your body, with yourself, with whatever feeling you're experiencing, whatever symptom it is. It doesn't matter what it is. You'll have to trust me on this. It is just a flow of energy. And once you begin to see things differently, you just raise your consciousness, which is just, paying attention. Your consciousness is your conscious awareness. It's about reconnecting again to yourself, to what is potentially underlying you at the moment that's led to your distortions, the wheels falling off your bus, your set of symptoms. And beginning to own it is incredibly powerful. It just makes you understand that it isn't something to be feared, to be squashed, to be suppressed, to be handed over to someone else to fix, because actually, do you know what? As a doctor, I'm not going to fix you. I can help you, I can support you, I can nurture you, I can give you the right treatment when it matters. But if you really want to heal, if you really want to understand what it is, what's going on for you now, you have to make those connections. So I guess my one word answer is curiosity.
Okay. I liked all three. John, thank you. Lovely words to leave people with, and I hope that's helped anyone that's listening, that's in that space, that says, yeah, do you know what? That gives me a way of moving forward out of where I find myself. So thank you again for speaking to us today. I've really enjoyed that. I'm a big fan of what you're doing. I think it's amazing. I can't wait to see it adopted, you know, all over the world in mainstream healthcare. I think it's absolutely the way we've got to go. Yeah, keep up the good work. Thank you so much for speaking to me today.
Well, thank you in return. Thank you for inviting me. It's been a real pleasure to share my vision, share my view of why people fall ill. So thank you for giving me the opportunity to. And yes, I hope we do spread the word. We're doing a little bit here in this little part of the UK, and I can only see it coming from bigger steps from here on.
Yeah.
So thank you.
You're welcome. And just to say then, if people want to get in touch and connect with you about what you're doing and just find out more, they can get you through your website, vitalityworks.co.uk. Yeah?
That's the perfect way. Absolutely. If anyone's got any questions, want to discuss things in more detail, I'm very happy to respond. Thank you.
Great. Okay. And that link is on your page on the Summit website. So brilliant.
Great.
Thanks, John. Thanks again. That was really enjoyable.
Thank you.
All right.
Bye.
Bye.